Welcome to the HerHealth Podcast, transforming health for women and girls at risk, where we empower women and girls to take charge of their health and well-being. Join us as we shine a spotlight on issues affecting women and girls' health and explore ways to create positive change. Get ready to be inspired and empowered as we discuss health, advocacy, and empowerment for women and girls at risk. Please be advised that this podcast may cover sensitive topics such as gendered violence. We understand that these discussions can be difficult to listen to. If you feel uncomfortable or need support, we encourage you to prioritize your well-being. Consider exploring our other podcasts if these topics are triggering for you. Resources can be found in the description.
Welcome to today's episode of the HerHealth Podcast. I'm your host, Sarah Yercich, and we are so excited to have Femi Akinsanya with us from Calgary Communities Against Sexual Abuse, or CASA. In today's discussion, we're diving into what it means to take a trauma-informed public health approach to sexual violence. We're talking about how trauma impacts survivors, what trauma-informed care actually looks like in practice, and how service providers can respond in ways that prioritize safety, dignity, and healing. Together with Femi from CASA, we'll also explore the bigger picture, how systemic responses and prevention frameworks can help build more equitable, survivor-centered support systems. Thank you for joining us today, Femi. To start, do you mind providing just a brief background on you and your work?
Of course, yes. Thank you, Sarah. So my name is Femi Akinsanya. I am the co-director of the Training, Resource, and Education Center at Calgary Communities Against Sexual Abuse. My education background is in psychology and also healthcare and medicine. I've been in the sector for 5 years, specifically the sexual violence sector. I've occupied many roles in the sector, from doing community outreach to educator, and in my current role as a program director, I've seen it all on various levels. So frontline to, the management side of this work. And outside of CASA, I'm a public speaker. I've contributed to many research projects in the University of Alberta and the University of Calgary. I sit on the City of Calgary's Gender Equity and Diversity Subcommittee, and I'm also the chair of the intercommittee group at the City of Calgary as well. So I would love to work to address the systemic barriers and limitations.
What a fantastic and amazing background, and how you still find time in the day to join us for something like this is so appreciated. The title of today's webinar, and also sort of the focus of this talk, was a public health approach to sexual violence. So I was wondering if a good place to start, would you be able to break down what it means and why it's important to shift from an individual lens to a systemic one?
Of course. So a lot of people think of sexual violence on a very individual or interpersonal level. So person A or person B, or the impacts on an individual of sexual violence. And often we remove ourselves or try to mute this larger systems that are at play. So the top down, bottom up. So public health really brings it all together, not just the various levels of the systems, whether it's community, organizational, familial, policy, but also the work of different disciplines. So medicine, nursing, psychology, social work, education and training, HR, policing, justice, and legal. So it really gives us a foundation to visualize how these various disciplines can come together and tackle it from an individual level, and also on a greater systemic level, on a policy level, on a societal level, on an institutional level. So having a public health approach really gives us, again, a stronger framework to imagine the impacts of sexual violence and what is impacting it and how it's impacting and to what extent it's impacting it. So whether it's a policy that's coming through, what is the impacts? If there's funding cuts happening, what are the impacts? If we are, giving different professions certain scopes, their scope is increasing, what is the impact? So it gives us more of that language in a very formalized ways to address it in that arena.
That's so well put, and I like kind of how you really explain both like the social ecological model you shared in your webinar presentation, but also there's kind of this web that you created of how all these areas interrelate and how trauma can be addressed in so many spaces. That was so fascinating. Thank you. The trauma-informed care is a phrase we're starting to hear more often, both socially and also within social services, laws, policies. We're really starting to have those discussions. And I see it emphasized especially in social services and in healthcare. So for you, what does being trauma-informed look like in practice? And what are some key principles you think are often misunderstood or overlooked?
Yes. So that is a very good question because it is a buzzword. And sometimes when words are buzzwords, they lose their meanings and it gets diluted over time, right? So we really want to put back the framework into trauma-informed care. So first, trauma-informed care starts with the unseen. It's my philosophy. As an individual, my personal life, what I choose to do and not do in my personal life informs how I show up as a professional. So again, it's my philosophy, my approach is, I say it's my why, right? And a lot of people that go into helping professionals, like, we want to support people. We love helping people. We want people to get through hard times, right? And that's kind of vague. We want to really specify it and say, I'm grounded. Like for me, my why for trauma-informed care is I see there's big gaps in system navigations and what is happening on all different levels using, again, the social ecological framework. So that's my why, because I see the impacts on people when the policy and the institutions are not as responsive as the individual doctor or social worker or therapist that's helping that individual. So that's my why. So framing your why and then going to very concrete and tangible things. So these are things that can be written into your workplace policy. Continuing professional development and knowing what it is and how to implement it in different ways, and things you can do in your individual work life. Again, sometimes you can get a plant or you can get, fidget toys for clients. And sometimes it is just as, every quarter we're going to do as a team, do a trauma-informed care session, do active reflection. Let's write down like, okay, these are situations that are happening. Was it trauma informed? Where do we miss and how in our workplace can we implement it? So again, there's a lot of variation of how trauma informed care can be implemented, but there's also concrete ways that it could be driven for that individual workplace or that individual professional in a workplace setting.
That's so well said and so practical, which I really appreciate. And I was wondering because I think one of the gaps or one of the unseen pieces is something you addressed in your webinar, that self-care element, where we don't think about self as often as we should when we think about trauma-informed care. Would you mind for our listeners speaking just a little bit more to that as well?
Yes. As they always said, you can't pour from an empty cup. And I believe that people do not take that as seriously as we need to. So again, your cup might not be all the way full to the top. It might not be overflowing, but if it's empty or near empty, you're getting into critical territory. So self-care is essential. And self-care, as they say, is not always this massages, the bubble baths, and the vacation. Self-care could be as just like simply having a routine in your life, especially any kind of very client facing or patient facing, very direct human role. I find for myself, it's good to have some kind of organization outside my in my regular life day to day, because my work life can be so unpredictable. It can
Mhm.
go either way. So my home life, with whatever you can do, because home life can be unpredictable as well for many individuals, but like different things you can implement to do that. And I always say, as a millennial, I think I come from a self-care generation, so it's kind of implemented in my generational understanding of how work should operate and who comes first. And again, it's coming back to, I can't help anybody. You have to help yourself first. I can't help anybody when I'm on my last 10%. So knowing and creating structures in your workplace, in your personal life, all of those things to have that. I always tell my friends, my family, and my loved ones, like, they know what I do for work. And sometimes it's hard to explain the impacts, but I said the impacts are real. It looks this way. So this is how you can help me. So I can help you and I can be in community with you in our personal life. So also bringing in your network of supports is really foundational for self-care and longevity and sustainability in this work.
And the way you frame that speaks so well to even that need of self-advocacy with the people that you love the most, being like, this is what you can do to help me on those days that I need it. That's so important. So, one thing that comes to mind, you've talked again a lot about gaps. In your experience, how does sexual violence intersect with broader issues like housing insecurity, racism, immigration or legal status? And with that in mind, how can trauma-informed care help account for these layers or help address them?
Yes. Sexual violence is a layer or tool of oppression. So we've seen it through millennia, through different cultures, different historical events, even things that are happening now, that it is a tool or system, is a form used to break down people on an individual level and on a collective level. Jeez. And on a collective level as well. So we see that again, the impacts of sexual violence is quite vast, and it is a tool. So in our work we talk about that sexual violence is a tool for violence and harm. The sexuality in sexual violence is literally the gun, right? It's the weapon of choice that day. But the impacts is the harm, is the violence. The violence is the end goal of it. I'm sorry, that beep
All
rejigged my
good.
brain. Question.
I've had that happen to me so many times. All good.
Oh,
But
sorry.
sorry, what were you saying?
Can you repeat the question, Sarah? Sorry,
Yeah,
that
of
beep.
course. Yeah. I've had those things happen where like a beep or a ding or you see an alert and you're like, what was I talking about? So what I was asking, and everything you said fit in there so well, is in your experience, how does sexual violence intersect with broader issues like housing insecurity, racism, immigration status, and how can that trauma-informed approach help us address or account for these?
Yeah. So yeah, it's housing, immigration. So again, housing, immigration, and all of those things are individual experiences. So someone and as an individual can be unhoused, but housing is also indicate like it's a broader systemic issue, right? And it exposed vulnerabilities and sexual violence, and people who have experienced sexual violence have also been the most vulnerable. Being unhoused and the uncertainty of being able to get housing, affordable housing, or any type of house, even shelter system, again, exposing people to the lack of autonomy and choice and how something can be taken away and experience. Sexual violence mirrors that same kind of psychological experience. So we see a lot of parallels, even though housing, you can see again more directly, you can see someone is unhoused or housed. And sexual violence is more invisible, but again, psychologically, it's manifesting in the same way. And again, going back to how it's an individual experience, but also a result of systematic failure. So we see them really come together in that way. Even immigration as well, not to get too political, especially in these days and age. But again, we see that again, being here as this, I'm a citizen, I'm a Canadian citizen, I'm a child of immigrants, right? There's a lot of uncertainty. I can imagine what my parents have experienced, what my the people around me, my community have experienced. It seems like such a straightforward process, but you fill out one line wrong and your immigration status can be taken away. Same like with sexual violence. Again, it's out of your hand. Even though you're one that's like responsible for doing the appropriate whatever, someone can come in, a larger force, a governmental force, and say, well, this is not enough, or we're changing policies, or we're changing quotas, and something can change really quickly. So that uncertainty is how it parallels, and how this loops into trauma-informed care. Trauma-informed care is great language because it's a way to hold systems accountable, and how allow systems to see people as humans, not numbers, not quotas, not a person taking up a bed, a person taking up X amount of dollars away from government revenue, or however we want to see it. This is a human being. So it allows us to pull together the humanity of the human while we are in a very governmental or high level institution where you're very removed from it. It allows people in those positions to somewhat humanize those people that they don't interact with day to day, but they are human beings with very real, very robust experiences.
That brings to mind for me when you talk about things like how this can help systems humanize individuals and how really we can start to work from that trauma-informed lens. For folks who are supporting survivors, whether they're service providers, community members, or even like we talked about, friends, family, what are some foundational things they should keep in mind to foster safe and survivor-centered spaces or even survivor-centered care?
Yeah. So our five key messages, I believe you, your needs come first. What do you need for support? However you feel in this moment is valid. All of those key messages are transferable from the most intimate personal connection, like from a parent to a child, or to, two partners to, again, a dentist, a doctor, a police officer. These are very transferable language. So this is how we, again, rooted, and that's where trauma-informed care exists. And also knowing, I guess, on a more family or like a more personal level, that when your family member is like accessing CASA or going to the doctor, there's going to be an element, like sometimes, and this is my privilege showing, sometimes it's like, I know when I go to a doctor, they're going to fix my problems. You never go to a doctor and say, oh, they're going to make my problems worse. They're gonna, add more layers for me to unpack with my problems. So we have this preconceived notions that where we're the institutions that say we should go for help, we're gonna get that help, but we don't have sometimes the space to unpack that this can add more layers to that complication. So as a family member, as a loved one, as a person, someone that's personally intimate in that person's life, just knowing when they go to CASA or doctor, not to demonize these systems because they're fabulous, amazing human beings and professionals in the systems, but it could add more layers for them to kind of unpack. So again, just rallying around and understanding there's a lot of things happening. One is not just this, even though sexual violence is the presenting issue, there are things and layers that can exacerbate or add more complication and add more dynamics to that person's experience and impacts of it, sexual violence.
That that's so interesting to think too, is because I also, when I go to a doctor, I just assume that my problem's going to be dealt with relative ease, and I don't think about that. And I think that's such an important message for all of us to not like in the sort of catchphrase, check your privilege, but really be aware of how our privilege impacts how we view systems and take a good, healthy step back and say, it's not about me, it's about this other person and their needs in their specific contexts. Thinking about that public health space, prevention is a key pillar in public health. How do we move beyond reactive responses to actually preventing sexual violence from happening in the first place?
Yes. So you probably all heard this before, education is key. But education is really the first mobilizer of primary prevention in our world of sexual violence, support and prevention. And education as young as possible. And kids are sponges. They know more and they can process more than we give them credits to as adults. But there's ways you can talk to a 3-year-old and introduce a conversation around the topic in a developmentally appropriate way that can allow them to move through the world with this education, knowledge, compassion, being able to support their friend, a loved one, support themselves, and also disclose in case, again, something happens. So we can get in quick, get that initial response, and get them what they need right away. And then, they can go on to live beautiful, wonderful, lovely lives. But education is really the first place that we put our efforts to. Again, we go as young as preschool with our Who Do You Tell program. Um, and that's a good way to also to bring the families into the conversation. So we just don't educate the children, the teachers, the caregivers, the parents. We really want it to be a family conversations. We use supplementary materials like children's books that use like dragons and kids fairy tales to really start the conversation about like sexual violence. And these are like kids book, right? With all the illustrations and all the stuff that kids, are drawn to, but they're getting very necessary information and is making parents feel like this is not a mountain I have to climb. This is not my Everest of parenting. We have lessened that into hopefully maybe just a little hill. I'm not going to say it's going to be 100% easy. Nothing there's something about this is supposed to be hard. There's a natural level of anxiety that you should have because this is the impacts are very real, but it's not in fear, but in a way that of like, this is my protective way. This is how I, communicate necessary information. So we want to make it a little hill, a nice little hill that you can talk to your kids with. And another way we can mobilize primary prevention is, again, in a bigger sense, a higher system level, is policy, funding, all of those kind of things, right? Knowing where our governments are putting monies. They say where you spend your money is where you show what's important to you. right? And that also talks about government. Again, money is a finite resource. You can't just print more money to, deal with everything, but there's a way money can be allocated and funds can be allocated to make sure primary prevention is off top of mind. And then the people who are doing the work are well resourced so we don't burn out or run into impact exchange or feel like it's a hopeless cause. So money and parenting.
I love those key messages. That's perfect. And the significance of education, I think, really came across in the information you shared today and all of our previous sessions also with Mary and Kira from CASA, that education really matters. And your education sessions are so informative and accessible. And I'm wondering if you could tell us a bit more about how you address something like power dynamics in your education sessions, especially with concepts like the power triangle, which was shared in earlier sessions, and how societal norms can reinforce harm.
Yeah. So power is again, it's a hard conversation for a lot of us to ask because we have to look within first, look at our privilege and position, social location as well. So we try to integrate it into every one of our presentations, specifically the ones with professionals. I remember we did one, I think it was 2 years ago this time, with the Cummings School of Medicine with their medical students. And we were talking about positional power and how that exists and the intersection of it all, because you can never take intersectionality from power and privilege. So for now, like I can use myself an example. As a Black woman in certain contexts, I could be the most privileged person in the room. Like if I go to a place with, maybe asylum seekers, newcomers, all of those things, I could be the most privileged person there, but it's dynamic. I could go to the room next door and be the most oppressed person in the room. So also realize these are not, they've ebb and flow, right? They're not like, there obviously there's a hierarchy. We will never take away from the hierarchy: racial, socioeconomic, education, immigration status, gender and sexual identity, disabilities, all of those kind of things. There are very much things that keep people marginalized and oppressed, but there's also things that shift and flows based on the context and the rooms that you're in. So again, it's not a way to demonize people and saying that, oh, someone that visually looks like they have the most amount of privilege. They're a Canadian citizen. They might be of European ancestry. They might be a doctor, lawyer. We're not looking at you and say, oh, you've never had a problem, a bad day in your life. That's not what we're saying. We're just saying the full context, and put yourself in the full context of the pyramid or the triangle or the flower, however you imagine, and knowing that flows. Like even if there's a doctor sitting in front of a therapist at CASA, the therapist in that context has more positional power than that doctor as the client of CASA. But that can be swapped in a second. The moment they step out of the CASA offices, that can switch. So also knowing the context of the interaction helps really disarm people when we talk about power and privilege.
And what a thoughtful way to kind of talk about how that is so fluid, how power and privilege doesn't exist as a fixed thing. And see, more educational moments. It's so powerful. Well, that brings me to the end of my questions. But before we wrap up, are there final messages you'd like to leave our listeners with?
Yes. Again, always keep learning. We keep learning in different ways throughout our lives, different parts of our lives and our responsibilities. Like if you're a parent and you've started a new job as a director, might require you to lean into certain type of like education and learning more so than others, but continue to learn and grow and interrogate yourself. Again, constant interrogation, not from a self-deprecating way and to put yourself down, but that's how you stretch that muscle and your capacity for discomfort and for things you can take in, process, and deliver. So it's a continuous process. You never stop learning and engage in different forms of learning. AVA does it amazingly. We're here over at CASA's Treks team to also deliver very good education, lunch and learns, YouTube videos, documentaries, even talking to people. Again, just conversation. So much education and knowledge exchange happens in conversation. So yeah, continue to learn and keep growing.
So well said, and what a powerful and thoughtful message to leave everyone with. So thank you. And thank you so much today, Femi, for joining us, for sharing your knowledge and your work. We're so deeply appreciative.
Thank you. Thank you, Sarah, and thank you, everyone.
Thanks for joining us on the HerHealth Podcast. transforming health for women and girls at risk. Remember, your health matters, and together we can make a difference. Until next time, remember to prioritize your health and well-being. For more resources and support on issues affecting girls, women, and gender-diverse people, visit our website at avatraining.ca. This is Dr. Nicole Letourneau. Thank you for listening.